Good evening. I'm Commissioner Jamal Miller from the City of District Heights. Very quickly, I have two comments. The first is I noticed that all four sites are actually in the traffic pattern for the stadium. And although the stadium is only used at its capacity maybe 6 or 8 days out of the year, as we all know, getting into and out of that whole area, 214, Route 202, and even the Arena Boulevard exit is a nightmare. And just to put on an idea of what is the plan going to be for traffic going into any of the four sites, considering the Redskins stadium or any time the stadium is used, because it will impact all four of any of the four sites. So that's the first comment that I would like to make. And the second one is wherever the hospital is located, that there are shops and restaurants and things like that around, because those people who are in the hospital, as I'm speaking as a person who spent a lot of time in my childhood in the hospital, had chronic asthma, so did my family, et cetera, et cetera, et cetera. And when you spend a lot of time in the hospital, it's good to have a shop, a restaurant, or somewhere to go to kind of ease the tension of whatever's going on. So wherever you build it, and I guess the Woodmore Town Center would be a natural fit because it does have some shops around there. But wherever it is, that there are some shops or some other things that families can do. And also it could be an economic generator because you'll have not only the employees that will need restaurants, but also the visitors that will come to the site as well. Thank you.
Good evening. My name is Janie Lince, and I am a resident of Prince George's County from District 9. I am so excited at the possibility of the demolition site that was formerly Landover Mall has an opportunity for redevelopment, and I know that the future is moving towards locations where there are transportation and residential and office and all of that, but I just believe Landover Mall the plot has been an eyesore for the past 10 years, and I'm just really devastated that our county has allowed this to happen and for it to be there. It's amazing how just the distance of the span of the Beltway, how much emphasis and power that has, that the three sites are on the other side of it. And there's not as much, there has not been as much favor for the Landover site to have that be redeveloped. My brother used to have a little cart there. People have talked about how they used to enjoy the mall. I remember going there as a young girl and riding the bus too, and the route is still there and available to go to the theater. Me, myself, I live in Upper Marlboro. The idea of taking the metro was just, as someone had mentioned, it would entail going out so far and coming back in, and that just would not work for me, even though there is another hospital that is closer to me. My preference has been more for the former Prince George's Hospital Center. And my comment is to please consider redeveloping that area. I know people have mentioned that there could be issues with the Lerner Corporation, but I think it is worth looking into. Also, in regards to the Woodmore site, one thing, as others have mentioned, in having two sites, would it be possible to build a bridge over the Beltway that would be able to connect those two sites if you're interested in using those sites? All right, and thank you.
Thank you very much. My name is Peggy Townsend, and I work for MedStar Health, so I have a different perspective on this. But let me say, this is an absolutely exciting time for hopefully conclusion of this issue that has plagued the county. I've worked with Senator Curry many times on this issue to try to finally, and it's so close. So I think it's an unbelievable opportunity to finally really develop a comprehensive healthcare system in this county that really thrives and is a first-class system, but it's also comprehensive. As many of you know, MedStar just purchased Southern Maryland Hospital Center, and we plan to invest upwards of $120 million in that hospital to try to improve services. And there's been a lot of talk about people leaving the county. One of the things we want to do at Southern Maryland Hospital Center is invest in cancer and neuro services so people do not have to leave this county and go into the district. It is our intention to bring people back into the county for those kinds of things. So I think there's some real excitement when you couple, some of our activities with this activity, some real opportunities to have the entire system developed in a comprehensive, it's really once in a lifetime opportunity that you are facing. A couple other things that we have in the county that I want to make you aware of. We just entered the what's called the health choice market. We have a Medicaid MCO, and that is now operating in Prince George's County. With the Affordable Care Act coming along, it should very much help with access to care, particularly to physicians in primary care. We have a research institute located in Hyattsville. It has 200 employees. Hardly anybody knows that we have this healthcare research institute there. And we have further plans to do those kind of things. We just had a grand opening at a Mitchellville Ambulatory Care Center about a month ago. It's a primary care office with rehabilitation care, OBGYN, and every week 20 different types of specialists rotate through that center. So we very much believe in bringing services into the county. So as you move forward with your site selection process, and as you move forward with this, we ask you to keep in mind some of the other assets you have in the county, some of the environmental changes that are coming forward with the Affordable Care Act, the HEZ someone mentioned. There's a lot of different pieces that are sort of new in the past 12 to 18 months, quite frankly, that really will bring a great product and services into Prince George's County. Thank you.
Hello, my name is Kimberly Green, and I live in the Landover area. My comment is for the Landover area for the hospital. I think that would be the best place for the hospital. My concern with Largo is the crime that has taken place over the years at the Largo Town Center. And if you were to develop there, what would the county do about the crime that has taken place? How would they step up security in that area? So in saying that, I believe that the Landover area would be best for the new hospital.
Good evening. My name is Debbie Sandlin. I'm the city manager for the city of Glenarden. And I'm actually here to speak on two sites tonight. Definitely the Woodward Town Center, because that is in our city limits, and would be a great economic engine for our city. It also has the availability of the pedestrian access. It has the retail you want for the patients' families. It has the restaurants that are there, and there are more restaurants coming on board, and there will be more retail coming on board. However, the Landover site is also an excellent site. It's very close to the Woodward Town Center, and the two could be connected very easily. It has the three key components you're looking for. High visibility off 495. You will see it as you're driving by the direction. You can't miss it. The accessibility of the ramps off of 495. It's central to all four locations that you're looking at. It is also an opportunity to partner with the city, even if you go to the Landover Mall, because the city will still benefit from the Landover site if the hospital does go there, because it will be a catalyst for future development and redevelopment in the city. I believe the Lerner Corporation will be very open and welcome a dialogue and a partnership with the hospital system. And I do believe that either the Woodmore Town Center or the Landover Center would be the ideal locations for the medical center.
Good evening, and thank you for the opportunity to speak to you today about the Regional Medical Hospital. My name is Rafe Ellison. I'm the president of Lake Point at Town Center Condominiums, which is one of the three HOAs in the Largo Town Center Umbrella Association. As you would imagine, I'm a supporter of the location at Largo Town Center. I echo all the reasons that were stated before as far as smart growth, the infrastructure currently being there, the utilization of the office that is currently down the road and other medical centers. But in addition to that, I want to speak about the housing stock that currently exists at the Largo Town Center area. I think it's perfect for nurses and residents who would be manning and providing services to our citizens here in Prince George's County. The housing stock is all built after 1990. Class A in the Camden Summit, which is like 240 apartments, and then there's another apartment building built in 2008. I think to have the best medical center, you need to bring the best talent, and having the best talent means high housing stock. I think Largo Town Center, all the sites, has that. In addition to it, you can walk to various places. You got post office, you got banks, you got movie theater, you got some restaurants, and with the medical center, you'll just get more of that. So, as I mentioned, I wanted to echo everyone who's supporting the Largo Town Center site, and hopefully that will be the ultimate decision. Thank you.
Good evening. My name is Elijah Gross. I reside in Prince George's County, and oh, you can hear me. I'm sorry. I just want to endorse the Largo Town Center site for one reason. They currently already have the infrastructure. They have shopping. They have restaurants. There's a movie theater. Just like the guy that spoke before me, there's a lot of housing available for residents and nurses. Also, one thing I've learned since living in this county is that if you're going to develop something, you wouldn't want to develop it at a site and then say, well, if we develop it, then new development will come once we develop it. You'll want to put it at a site where you currently have development, which is at Largo Town Center, and then it would just build up, and then possibly it would spread out to the areas around that location. So.
Hello, my name is Sherry Moore, and I am a 16-year resident in Prince George's County. I live in the North County, North College Park area, and so I was very interested in hearing about the proposed sites. The lady that spoke about access for those living in Greenbelt would have the same problem for someone living in North College Park, meaning that the Green Line has no access to any of those points. It would be very difficult. So I hope that you would consider transportation issues for the North College Park area into your planning. The second point that was spoke even more to me is that with 9 years working at Howard University, and it's affiliated, not with the affiliated hospital, in the medical center, and 5 years at the University of Maryland, a lot of academic background there, I was really excited to hear about the bringing University System of Maryland in the county. But I want to say that throughout the 15 or so past years in the county, the hospital I've used has been Doctors Community Hospital. And so even when I was at Howard, and my brother and father were trained at Howard, as medical physicians, I still went to Doctors Community Hospital. And so when the other lady spoke about MedStar, I was really surprised throughout the presentation that there was no mention, and the other person spoke about Prince George's Community College, their health system, which Doctors does work with. There was no mention of how the site planning or the planning incorporated all these other enterprises. My husband uses Southern Maryland. We make that drive to Waldorf. And so for spine services. So I just wanted to, in your planning, I would like to see how I don't know how to put this simply, how you are working with the other entities for access and access to health care. Last but not least, on those sites, since I'm all throughout the county with a child at Sandlin and another child in Montgomery County, those 4 sites are in a heavily trafficked area, and you would have to, I think the county would have to spend a whole lot more money on developing transportation solutions that are going to meet the needs of the county. Thank you. The residents. Thank you.
Good evening. My name is Greg Hanna. I am a resident and also a part of the Bulk Hill Homeowners Association, which is located over near the Woodmore Town Center site. I first would like to acknowledge my district councilwoman, Andrea, the best district in the county. Sorry. We'll talk later. A lot of people have said a lot of wonderful things about this site, and I applaud you guys. I know that you have a very tough job and a decision to make, but this is really a great opportunity for the county, for the economic development here in the county, and it's a really good opportunity. I'd like to echo one person earlier who mentioned that this is a great opportunity for innovative ideas for those emergency traffic lanes. Any one of the 4 sites, I think those things should be taken into consideration. I'm speaking on behalf of my side of the community, and I go to a lot of community meetings with the groups that are over there, over in the Bulk Hill area, the Rocky Gorge area, and I would not endorse the Woodmore Town Center area. I think that it is a great site in terms of the retail and everything and that nature, but there is a lot of development going on in terms of residential development over there. We already have a fire department over there. And so the emergency noise going through there with helicopters and everything of that nature, along with the heavy traffic that will come through with that particular site, I think would create a lot of disturbance. Not to mention the serpentine between game day and also coming off of the Beltway trying to get into that site. The traffic plan that's in place right now for that site is actually pretty good, but I'm sure it's going to change dramatically once the rest of the residential and office pieces go in there. There also is big anchor stores there at that site. You have Wegmans, which generates a lot of traffic, and you also have Costco. And if you've ever been over there, especially over near the gas pump area, it tends to get kind of long. So within hospital site, as well as all of the dynamics that are going in with the existing stores there, I think it would create a pretty interesting challenge in trying to make sure that emergency care is getting to a facility at that site. I would endorse the Landover Mall site as well as the Largo site. At the Landover Mall site, I agree with a lot of residents here. It is an eyesore. It's been that way for some time, and I think a lot of residents are ready to see that area developed. It is a perfect area for a neon sign right off of 95, and it's a lot easier for infrastructure to get in there. Also at the Largo site, just to echo, you have the University of Maryland, and you also have Prince George's County Community College there. And so I think that would be a great opportunity along with the transportation and infrastructure that will go at this site. Thank you very much for your time this evening.
Good evening, everyone. I am Timothy Macintosh, and since we are giving out checks, I will endorse my councilman, Derek Davis of the 6th District. I sat in the overflow room there, and I had not planned to say anything, but I just felt compelled to just mention one thing, as others have talked about the Landover Mall site. I, as a public citizen and resident of the county, and my wife, have dealt with the Lerner Corporation. My daughter and I'm just saying this to caution you, because I don't think that the Lerner Corporation is going to be all in it for the people, but they're going to be in it for whatever they can get. My daughter had a store at the 8 shoe store at Landover Mall some years ago, where she sold large-size ladies' shoes. And of course, the rent was rather expensive after a while, because everything that she made she had to give to the Lerner Corporation. But you try getting out of a contract or negotiating a contract with the Lerner Corporation, who's in things for profit. Even after my daughter left to go to another location, my wife and I paid thousands of dollars per month to finish out the contract that Lerner would not negotiate with. So I just caution you, when you are talking to the Lerner Corporation, make sure that the residents are foremost in your consideration. Thank you.
Good evening. My name is Faye Howell, and I am the president of the Tri-Area Civic Association, which is located very close to Landover Mall. I'm here today on behalf of speaking for Landover Mall, and I keep hearing about the Lerner Corporation, and I hope that with all our council members and all these smart people in Prince George's County, that we can figure out a way to get around that. I don't know what it is, I don't know what it takes, but I hope that we will take this opportunity to try to build this center at Landover Mall, and if it does fail, which I hope it won't, that I hope that we will figure out some way to do something about Landover Mall, because it's a disgrace, and it's been that way for years. And I think that this would be a good opportunity for us to try to get something done with the medical center there, because it's very important to the people of Prince George's County. So use this opportunity to try to get rid of whatever obstacles you're having at Landover Mall, because it needs to be improved. It is the worst site in this county.
Good evening, everyone. My name is Marcus Curry of Infinite Brand Realty. I think I'm the last one to speak. Initially, I was going through the notes, listening to everyone, and could not forget the 6 points that were brought up of a central location, access to transportation, cost of the site of development, the size of the site, timing of site control, and the future development. I'm going to skip all that. It's late. Basically, my generation is the future. I'm a recent graduate. I'm 23. We're already burdened with enough costs, etc., taxes, and I think we can all agree on that. What we're looking for is a central hub. We're not looking to go get, everyone likes a nice car. It may not be viable. If we have metro access, if it's a walkable community, if I can get to my job without the burden of wondering, okay, do I have to go here? Do I have to go there? Largo Town Center makes the most sense. All of these sites present challenges. It is a central location. It is next to FedEx Field. So all of them have that same challenge. However, we can eliminate some of those challenges by putting this medical center at Largo Town Center. The infrastructure is there. That already within itself reduced the cost. Therefore, why add on? That to me does not make financial sense. So all in all, as someone speaking from, I guess, a future perspective, I really believe that it makes the most sense to put this medical center at Largo Town Center. The infrastructure is there. It will reduce the cost. It's easily accessible. It's what we're used to. We go to universities that are central hubs. We're used to metro. We're used to getting in and out. That's what we need. Thank you.
I'm going to offer one more last time for anyone who may wish to speak. If not, we want to thank you for attending this evening. Thank you for your comments, and really want to say, if there's no last parting words, good night. Have a safe drive home. Thank you so much.